what happened was I got frustrated, so I had to voice my concerns on Twitter,
Right.
and an NHS trust reached out to me. My local NHS trust reached out to me within seconds of me
Oh, wow.
going kind of not viral per se, but you know, saying, "Oh, they can help me. What do I need?" Yeah, they basically, it was damage limitation is what they were trying to do. But I was just fed up and bringing people and being kicked to post and pillar, and no one give me a straight answer. And even just to find out that NHS trust that dealt with my condition in a national aspect were unaware of how many people had trachees within England.
Wow.
They knew how many people had them, but they couldn't give me a tangible figure on how many people were walking around with them. So if they can't even do that, how do I expect to get deliveries to my house?
Fab. Hey, Nana.
Hello.
Thank you so much for joining me today. I'm really excited to talk to you. When we were chatting earlier on, I was just explaining that my quest is to speak to people inside and outside of my industry, raise awareness of our needs, and also discuss about how we can collaborate and work together to develop things for our needs and the future. And that's really why I reached out to you and wanted to talk to you. I know you for some years now, but your
Yep.
story is so impactful. And I think people in, especially the pharma, biotech, medical device companies, they need to hear your story because they are developing drugs or medical devices, wearables for people, and they really want to do things better. They really want to get insights from people from various backgrounds so that they can ensure that they're building, and developing things for people that need them. So, with saying that, I'm not going to ramble on. Nana, can you please introduce yourself to everyone?
Okay, so my name's Nana. By day, I've got a day job working for a local authority. By night, yeah, like I'm a villain. By night, I'm a disability advocate, and an advocate for people with disabilities who are struggling in the workplace, who find it difficult to have their voices heard within those nuanced spaces, educating them as well as educating employers to really open up and work with people with differences without it being too complicated, too legalized, just a simple conversation that can harmonize and bring a lot of disabled people into the workplace.
That's fantastic. That's amazing stuff. And how long have you been doing that?
Uh, since 2016.
Okay, amazing. And do you feel that you've been having much impact so far in your
Oh,
journey, on your
oh
journey?
yeah, oh yeah. Managed to get a few people who, in an ideal labor market world, wouldn't have got jobs or wouldn't have had their applications looked at because employers don't know how to handle disability. So if we're talking about success rates, we're looking about 70% of people that I've come across that I've helped in
Wow.
different aspects, from social circles to professional circles, working for ESF programs, which is the European Social Fund programs, which are targeted at employment, working on a scheme that was brought out in 2016 by Theresa May called the Proof of Concept.
Oh, amazing.
Proof of Concept was meant to be a program to really test the waters of how disabled people can enter the labor market. So that, so looking at different aspects of that.
Okay, so right, already I can think of so many questions that I'd love to ask you just based on that as well. We may not have
Mm,
time today,
Yep.
and if you're happy, in a few months' time, we can maybe have a follow-up conversation just about your platform and the influence that you have on, with your platform and your community. But going back to something you mentioned about supporting and helping and enabling disabled people in the
Mm,
workforce,
Yeah.
I read one of your posts and you said, growing up, I never really thought about my disability. It wasn't until I was 8 years old that I realized that I was different basically from everyone else. But it
Mm,
wasn't because of the hole in my neck, it was because of how people treated me.
mhm.
So I wanted to just jump off of that and just ask, are you comfortable to talk more and tell us more about your condition?
Yeah. So with my condition, it's rare. I was born 6 months premature, and based on that, in society's view, tragedy. I wouldn't really call it that, but based on that unfortunate circumstance, my airways didn't develop with me, and based on my airways not developing, I had to have emergency surgery at birth to have a tracheostomy embedded in my trachea area. And obviously, because my organs had not grown with me, I then had to be put in an incubator for 2 years of my life to really grow and be strong
Wow.
before I was put into community, which also had its own ramifications of me, building my immune system for one, being able to eat solid foods, which took some time. But the whole significance behind my condition was everything not being of mature status at the time of birth. So you can imagine being born, premature, 6 months premature. A lot of my organs were still developing. So that impacted heavily on my vocal cords.
Wow, that's so interesting. I never knew you was in an incubator for 2 years actually. Yeah, no, that is actually really profound. I mean, I've known you since 2012.
Hmm.
Nana and I worked together during the Olympics 2012. That's when we met, and we just merged. We've been friends ever since. And it's just crazy, like how the world is. Like, how was life for you growing up with your condition? Like, did you grow up mainly in the UK?
Yeah,
Okay,
with,
okay.
with the condition, yeah. I mean, parts of my life was in Africa, but majority of my life where I became alert and knew I was different. Yeah, I was raised here.
Okay, fab. So how was life for you growing up in the UK? I'm talking school days, secondary school, uni, the impact that your condition would have like on your day-to-day life. How was that experience for you?
Okay, so nursery, I wasn't really alert to know that there was something magnificently wrong with me. Nursery was, from what I could remember, fine. I think it's more primary school where I became self-aware, with me being different when it was break time. I wasn't allowed outside during the winter periods. I was, you know, ushered indoors. I couldn't really play when my friends were playing outside. In terms of secondary school, I wasn't here for that because at the time when I was growing up, the doctors gave my parents an option whether to take out my tube and to watch my organs grow whilst I was still growing, or to leave the tube in and to just manage my condition till I grew. And obviously, the decision my parents took at the time was for me to have my tube taken out, live without it, and watch my condition as I grow. So, parts of my life from the age of 11 till about 14, I had the tube taken out at 11 or 10, went to live in Africa for the majority of my life. So I'd say, what, 4 or 5 years of my life I went to live in Africa. And it was an experience,
I can
living in the
imagine.
country, sun 24/7. That was all good. But I think because of the weakness of the area and knowing that when it comes to those kind of vital organs, it wasn't going to grow. Those areas don't really shift. Everything integrated in terms of my trachea, and I had to come back in '97, which was the latter stage of secondary school. So we're saying we're talking about year eight, heading on to year nine. So I'd missed the actual initiation of going into secondary school.
Yeah.
By the time I came, my peers were ahead of me. So my actual year group was 99.
Okay.
They, yeah, they actually finished, but because of everything I'd been through, I went a year back.
Okay.
So I actually finished secondary school in 2000.
Okay. Right, that's so interesting. Same as me, by the way. 1000. So you had experience in the UK and, some years as well in Africa. Did that did that change the trajectory of anything for you? Just having that experience of living in Africa?
I think as a child, I got excited chasing chickens, goats, and all, being in a country where it's predominantly black people. I think my mindset on how life is is molded me to now. So I understand the ramifications of not having clean water, ramifications of not having a good education, and if your parents can't afford it, you're being out here or being kicked out of class. In terms of myself growing up, I wasn't around when this country was going to pot when Stephen Lawrence got stabbed. So, in terms of being that radical kind of young teenager, I think I was sheltered from it.
Right.
In terms of my health, as I said, everything collapsed. I started to have blackouts because there was less oxygen going to my head. So there was a quite imminent importance for me to come back and
Right.
have surgery.
Right.
Because if I stayed in Ghana, say another month, we're talking about 97, I would have been dead because
Wow.
there was less oxygen going to my head. At the time, I didn't know this. I thought I was just having regular headaches,
Right.
but it was due to the lack of oxygen reaching my brain.
Wow. Wow. Well, thank goodness got back and
Yeah.
you okay. And kudos to your parents. So, in saying that, obviously, you've had loads of experience with the healthcare system.
Hmm.
And I wanted to just get from your viewpoint so far, what has been your experience overall? We could talk about Africa later, but overall in the
Mm.
UK, what has been your experience with the healthcare system? Has it been quite positive or negative? Have you felt heard? How has it been for you?
If I'm looking back on when my mum was in front of the wheel of my health
Mm.
uh, challenges, I just remember her fighting. If I'm being honest, she was always arguing with someone about something not going right or something not being personally centered towards me. It was more of a generic support system rather than looking at what actually benefited me with my condition, my health impacting my educational side as well. It kind of intertwined. So the health side of it, in terms of me gaining community support, wasn't great, which then impacted and impeded me going into secondary school because the community at the time they understand my condition because your community nurses couldn't understand how to support me adequately when it came to me having regular supplies in terms of tracheostomy tubes. Again, it was really it was an experience that I wouldn't wish on anyone. I had to fight just to have tubes delivered to my home. I'm still in that predicament at the moment. It's very difficult for me to get tubes sent to me,
Why
and
is that, Hannah? So that myself and the viewers can understand why is it so hard for you to get tubes delivered to you?
it's a
'Cause
funding. It's a mixture of a funding issue, and it's a mixture of when you're a person with a tube and you hit the age of 18, you're you're kind of invisible on the NHS. They're aware that someone in the area has a tracheostomy tube or tracheostomy condition, but in terms of proper aftercare from community nurses, your GP, intertwined with a trachea specialist hospital or center or whatever it is,
right,
those three chambers which come together to enable that you have a smooth kind of bubble to protect you isn't
right,
there.
right,
So lucky for me, I'm still in contact with my trachea specialist nurse.
Okay.
So that if it worst comes to worst, I can walk into a guy's hospital and get tubes. But
Right.
it shouldn't be me having to make a
Right.
trip to a hospital and claiming the ward's supplies, which are used for people who have come out of surgery. It shouldn't be that I should get a separate delivery to my home. And it's just to do with funding, because I remember in the early millennia, say what, 2008, 2009, one of the GPs turned around and said, oh, the tubes cost £50 and you'd have to fund it yourself. So £50 per tube. So
Wow.
imagine I'm working full time. Back then I'm bringing home what 1,002. So 50. If I wanted say 15 boxes of tracheostomy tubes, 50 divided by 1,000, or that's my whole paycheck. That's
Yeah.
even before I've
Yeah.
paid for anything. I was
Yeah.
thinking, nah.
Yeah.
So I just think there isn't a proper structure in place when it comes to people with certain conditions. The support is lacking. The fundamental core of funding isn't structured, and it impacts and impedes a person's condition even more.
Okay, so there's definitely an infrastructure issue that you've mentioned there because so who's your first point of contact uh, with regards to if there's anything you need or if there's anything going wrong, who do you go to first? Is it a healthcare professional like the community nurses, your GP, or do you just contact your consultant, your consultant? Who's your first point of contact?
My tracheostomy specialist nurse,
Okay,
because
okay.
my consultant unfortunately binned me when it came to COVID.
He binned you.
Yeah. So
What?
when it
What?
came when it
Okay.
came to COVID, I got a letter in the post saying the whole hands on deck for people with COVID, and I was being taken off the register because at that time, or in their view, I wasn't a priority to be on. Yeah, yeah, yeah. I wasn't a priority to be on their books. However, if I needed support or if I needed them urgently, I could always contact them and be
Right.
brought back in. So in current real time, I don't have a consultant per se, but I can access one by nudging my trachea specialist nurse.
Right. So, of course, that thing that happened, which I won't name because they're censoring videos nowadays when you say that thing that
Yep.
happened to the world, it was catastrophic, of course, and it changed all of our lives. I'm asthmatic, for example, so I was told that I was, high risk, so to
Mm,
so to speak. And I
mhm,
would assume that you 100% would be high risk as well. So
mhm.
for you to have been removed off of the list is actually quite unbelievable. And also, just a pattern I'm hearing, Nana, is that you're having to fight for everything. It sounds like everything you need. Because one question I wanted to ask you was, do you feel heard? Are your needs being met? And it just doesn't sound like it has been at all. Like your whole journey so far, you're having to fight really for everything you need, even in
Y-
adulthood.
Yeah, I mean, I'm being heard, but I'm only being heard because I'm being aggressive.
Right, you shouldn't have to be aggressive.
Yeah,
Okay, so this is where we're going to go really deep now. Do you know many others or speak to any others who have the same condition as yourself?
yeah. And one of my friends I grew up with from childhood, she's got a trachea. Different reason why she had one. Different
Right,
circumstances to me, but she has a trachea like me. Um, and she goes for the same thing in terms of orders, deliveries.
right. So it sounds like this is an overall issue for people with your
Yeah,
condition. Is that correct? Okay.
yes,
And it sounds like it's been going on forever,
yep. Since
or
night since
your whole
since
lifetime.
since it was a little bit better as a child. They do
Okay,
say
but since you
children
hit
are
18,
always, yeah, they do say children are always looked after, which is true.
right?
But when I got to adulthood, when I hit 18, it's like, poof, you're
Mm,
adult now. You can do what you need to do. You don't need us. And I've been fighting from then. till now, and it became, should I say, the weight that I carried from then till now kind of eased, I would say, just before the pandemic, because what happened was I got frustrated. So I had to voice my concerns on Twitter,
Right.
and an NHS trust reached out to me. My local NHS trust reached out to me within seconds of me
Oh, wow.
going kind of not viral per se, but you know, saying, "Oh, they can help me. What do I need?" Yeah, they basically, it was damage limitation is what they were trying to do. But I was just fed up and ringing people and being kicked to post and pillar, and no one giving me a straight answer. And even just to find out that the NHS trust that dealt with my condition in a national aspect were unaware of how many people had trachea within England.
Wow.
They knew how many
Like,
people had them, but they
right.
couldn't give me a tangible figure on how many people were walking around with them. So if
Wow.
they can't even do that, how do I expect to get deliveries to my house?
Right. Absolutely. Wow. So the data wasn't there,
Nah.
basically. How many? Wow. Wow. That's incredible. And it's even like a deeper hole for me because you know what I do. I'm all about driving awareness, improving data in clinical research, especially as it pertains to equity. So that's for everybody, no one
Mhm,
left behind, so to speak. And I'm
mhm,
massive, massive, massive. I'm massive on data. I believe
mhm,
data tells stories, and if you don't have it, then we can't really paint a picture of where we are. So that's really important. You
mhm.
mentioned something earlier that when you came back to the UK from Ghana, and you had to go back a year. You missed like the whole Stephen Lawrence era and that whole, I guess, fight and just experiencing what that was and trying and seeking justice. And that you wasn't really an activist, so to speak, in that way.
Mhm,
But you've actually like full circle has come around and become an activist, especially for like disabled people. But I
mhm.
wanted to know in terms of like healthcare or your condition, have you done much activism there at all? Or is it just something that you just focus on day by day with your healthcare professionals in your daily life and try and fight through?
I think it's more on a standpoint of my personal journey
Yeah.
rather than fighting for everybody. I think with me, how it became a pinnacle point for me in terms of supporting people was through employment, because you notice that a lot of employers at the time was advertising a two-tick guaranteed interview scheme. They were quick in getting people with disabilities into employment. And once people with disabilities were in employment, I can talk from my experience, everything crumbled. So it's like you're looking at the shell of a castle, but when you enter the castle, that's when it's all tricky and everything's wiring's coming down, bulbs are crashing, and everything's just not stable. So I became an advocate because employment became a hindrance to people with disability, which then impacted the purple economy, which is the disability community's form of economy. And, there's 14 million, no, it's 15 now, 15 million people with disabilities in the UK. So that's a huge number, and we're not understood. There's only there's a minute number of people with disabilities in employment, and when people do get into employment, they're walking back out because the support system isn't there and people are not understood. So I think for me, in terms of my actual condition, it's isolated
Right,
for the reasons why I fight, and it kind of interludes into a bit of everything. So housing, employment, and
right,
health. So I went through everything because I went through a time in my life where I went through the homeless system. So I
right,
had to fight my disability to gain housing. And when I gained housing, employment for me as an individual, I've not struggled with employment. So when people with disabilities, various disabilities, are talking about struggles of getting employment, I feel like an imposter when it comes to that, because I've never had that trouble of passing the sifting process or being interviewed. I love to talk, so
I know
so
it.
I love to talk, so it's not a struggle with me, selling myself to an employer why I'm good at something. Yeah.
No, no, that's very interesting. And the part that sticks with me the most is you said you're just not understood. Disabled people are not understood, and why
Mm,
not? I try to encourage the industry that I'm a part of to
mm,
co-create and collaborate with people of
mhm,
everyday life, because all of us in my industry are people too. So you have to
mm,
approach things in a human way and
mhm,
co-create and collaborate so that you can understand people better and
mhm,
their needs is very, very important. And
mhm,
why the healthcare system or medical research industry struggle to co-create still, I'm unsure, but honestly believe that it will solve a lot of problems and close a lot of gaps. Which leads me, I want to bring you a bit more into my world now and
yep.
test your knowledge a little bit.
Cool.
Let's test knowledge. So, did you know the pharma industry globally is
Mhm.
worth estimated 1 trillion, was estimated 1 trillion in 2022? Did you know that?
I didn't know that, but I'm not surprised.
Not surprised. And also the medical wearables or medical device industry will be valued in 2026 at about just over 30 billion US dollars. So we're talking, and I could go on about biotech industries. It's massive. So I
Mhm.
want to test your knowledge a little bit. Do you know what a clinical trial is?
Yeah, clinical research for drugs or anything of that magnitude, testing on people before it's out to the general public.
Okay, okay. And have you ever taken part in a clinical trial before?
Never.
Okay. And would you? Is it something that you would consider?
Not necessarily, no.
Has anyone asked you about taking part in a clinical trial or asked you to like brought up a child in a healthcare setting to you ever before
In terms of, like, say, doing it as a survey, yeah,
as
but
a
not
survey?
actual using drugs to see if it will work with me or not. No.
Okay. Okay. And do you think clinical trials are important? In your honest opinion, are they important?
In my opinion, I feel when you're being given a drug, they're saying it's going to cure one thing, but then it's damaging something else.
Okay.
So, in my personal opinion, I understand the structure behind it and why people need to research it. Would I want to do it? Not really.
Okay.
Do I think it's needed? Possibly, but again, I think it's the impact, because it's the impact of the unknown.
Mm-hmm.
Yeah, the reason why you're doing this research because you don't know how the drug works. You want to use it on someone to understand how it works,
Oh,
how it will map out in terms of larger scale community, but you don't know the damage you're causing on the person who you're testing it on.
yeah,
So I think
absolutely.
that's where I'm not too 100% on,
Okay.
because that person will be damaged. We don't know what
Mm,
damage will happen to their organs or whatever, mental health or whatever.
mm,
And I don't want, once one part of the drug works effectively, I think people who do tests just get excited and
mm.
forget the rest of population. I don't want to mention a situation which we lived in, but that's a prime example.
Mm-hmm, mm-hmm. No, it's very, thank you for being so honest and open about that. And I appreciate that because in all what you're saying, it's it's what I expect. It's what people have said, is how people feel. There's a
Mm,
general sense of mistrust when it
mm,
comes to clinical trials. And also just the transparency of the unknown. Like you said, you just don't know what the side effects could be. You know, pharmaceutical companies are very open and honest about what they're testing. So, in the sense that they are testing the safety of a
mhm,
drug, and there could be, side effects, there could be things that could happen. It is
mhm,
a risk. They have
mhm,
to be 100% transparent on that. And things have happened that should never have had happened in the
mhm,
past, in clinical research through negligence as well. But all in all, having said that, if we think about a lot of the treatments available now to the
mhm,
world,
mhm,
a lot of the medical devices or medical wearables, even like for yourself, that's available to the world now,
mhm, mhm,
if they had never been tested or trialed, they would not be available now. So those very brave human beings who, dedicated themselves to research, which enabled us to develop and get to this point. Having said that, would that change your viewpoint just a little bit on clinical research, or is it just a no?
I think for me, it's just a blank no.
Okay, okay. So in that case, do you think that, okay, you mentioned that it's needed.
Mhm.
What about for the future and people suffering from major conditions? Is it still needed for those conditions, or it's just gonna no?
I mean, just because for me personally, I'm thinking a no. 60% of the world need a cure, don't they?
Sorry,
Um,
again?
60% of the world need a cure, don't they? You are gonna have people that are not gonna go through a procedure to be infected by whatever drug is being administered to them. But I feel it's a personal choice,
Yeah,
and I feel if people wish to be used for greater good, it's their choice. And those of us who don't want to go through that risk, we can choose to say no, and we can look at the statistics and the experiences of others and base our decision on whether we take that drug when it comes into population or not.
absolutely, absolutely. Fair enough, and well said. So me and my company, we are very, very we're advocates for improving diversity in clinical trials and driving research across Africa, something that we
Mhm,
are knee deep in, and we do. It's a business objective, and it's, a moral objective for us as well. So I wanted to talk a bit deeper into just your real life lived experiences. And I'm going to
mm,
give a really very minor example, but for example, like back in the days when we used to have plasters, they were just a normal kind of like nude beigey color, and that
mm,
was it. I never thought about why isn't it in different colors. It's just a plaster, and that's what they look like, so you just use it. But
mm,
nowadays, like plasters and bandages, they come in various shades, right, to match different skin tones, for example. That's
mm,
a minor example. And things have
mm.
come such a long way, and they've changed, right, to adapt more to everyone's needs, which in my opinion is great. So would you say it's the same now for your wearable device that you have been, that you've used for, well, since you was very young now? Have you had seen any changes in just even the look, the feel of your wearable?
No, because I'm a black man, which you can clearly see, and my tube is white. It
Mm,
sticks out. There isn't. I don't think there isn't diversity within the tracky world. Some people wear it as a jewelry. Some people those that can wear silver. Unfortunately for me, I'm allergic to silver. It shows that I'm a vampire. I'm a vampire at night. Yeah, some people are lucky to be able to wear a silver version of my tube, but
okay,
in terms of skin tone, the texture, there isn't diversity in there. I don't see it.
okay. And has anyone ever asked you, how does it feel? Could it be better? What can be done to be better? Have those conversations ever happened in your
N-
experience?
Never had those conversations.
Wow, wow.
It's just a product is made. either shipped from Germany or the US, and it's like, bam, here's a product, see how it feels. If it's good with you, cool. There isn't, we're not kind of assessed or personally looked at as individuals with different needs. I think with the trachea world, we're seen as one mass of people who need a tube to reconstruct or to manage our respiratory system, but there isn't a personal centered approach to the device.
Mm, very interesting. So, if you could, because obviously you are the expert in, in your condition, and you've worn the trachea for many years. So,
Mhm.
just off the top of your head, if you could change anything about it, what's the first thing that pops to your mind that you would change about your trachea?
I think how the trachea feels. It feels very not soft. It feels a bit rough, plasticky. I think the color to match a person's skin tone, I think that's important. And the magnitude of having to take out a tube often to
Mhm.
clean, which then impacts because foreign objects, when I take it out, I've got to use saline water to clean the wound, then clean it out, put it back in. So if I could, I would love to have tubes that were flexible in wearing, could use for a bit more longer than 6 months. There are tubes out there that you can wear for 6 months, but it would be better if it could be worn for longer because these ones that I have now, they're disposable every 2 weeks
Okay.
because of the texture of the tube. You can wear it and sterilize it, but if I've got like a bad chest infection, then I'm changing that a bit more frequent because we
Mm.
can't afford to have extra secretions which are infected, lingering around the trachea.
Wow, it's very interesting. See, to our viewers, anyone who's working in the Trekkie medical device or wearable, companies, industry, here you have an expert in his condition. If you're developing anything, get in touch with Nana. I mean, he has some insights for you, definitely. No, thank you for that, Nana. I really appreciate that. And this is the type of information I'm trying to get to the world, like just everyday people's lived experiences. And obviously, you
Mm,
do a lot of amazing stuff outside of that. You're just wonderful, okay? But,
yeah.
but those insights, we just need more of that. We just need more of that, to be honest. Okay, so what can be done then? Because it seems to be difficult for
Hmm.
members of my industry.
Hmm.
I don't think it is, but in your opinion, what can be done to involve people more in this design process, in just your lived experience, your quality of life with the device? How can they involve yourself more in the development and making it better?
I think in all aspects of my condition from the get go, conversation of the individual, not a conversation of the parent, not a conversation with people who have been surgeons for 30, 40 years because something's worked. That's
Mm,
the way it should be. I think first and foremost is a conversation with the person who actually lives and uses the product because we're the ones that can tell you what is going wrong, what feels right, why a change is needed. We are the the drivers of the vehicle, so we
mm,
should be consulted and mass consultations should occur and people should be brought in to have their views because there's only so much you can write on a paper, and when you write on a paper or put it in writing, it projects different from when you're in person speaking about your experience. So I think a level of, yes, have your traditional way of getting a survey and understanding the mass problem, but also have a face-to-face conversation with people who use the device on a day-to-day basis to understand personal centered approach for everybody. Because we may all have a tracheostomy tube, or you see me and my friend, we have a tube, but there's different reasons why we have it. And it feels she may prefer to have the tube I have. She may not see a problem with it, but then I do, because skin texture is different, ethnicity is different. What works for someone else may not work for somebody else. So it's just being open to listening. Sometimes we may come across like we're whinging or complaining, but out of that noise we're making, you're able to pick sense out of what we're trying to get you to do, or how we want the lived experience of others coming after us to feel.
Right. Because that was my next question, and it may sound like a silly question, but just to emphasize, like, what will the impact be on the lives of yourselves and other people like you or people to come if they just include you in improving your device, making it better? Like, what will be the most important impact on your life, you would say, that that would have if you was just asked?
I think the impact it will have is it'll probably prevent me from having regular chest infections, because
Right,
obviously taking the tube out, sterilizing it, I've got to do that every morning. So you can imagine
right,
it's a lot. So I think it's looking at the longevity of the device, the practicalities of how it impacts a person's condition,
right,
and just making sure that yes, you're doing it for the right reasons and you're not doing it for a profit margin. You're doing it because you want to help, rather than because I've made a complaint. You're quickly manufacturing these things in batch, but you're not actually taking time to tweak and understand how that device feels with that
right,
person.
right,
So I think it's just understanding how that person feels when they have the device in them. You want a person to walk away with a product and have a smile and tell
right.
others that, this tracheostomy tube feels great. It's something that I would recommend, rather than have me who's wearing this tube at the moment and it's not comfortable. I have to find different ways of dealing with the uncomfortableness, and it's causing me more of a health impact than saving my life.
Right.
So it's just looking at all those aspects to enable that person doesn't struggle with their condition.
Absolutely. Thank you so much for that, Nana. You've been so amazing. You're doing so much great work in the world. I don't know how you have the time to do all the things that you do. I really appreciate your time in talking to me today. And, it's going to be a mixed audience, people from my industry, outside the industry, people with a tube themselves. If
Mhm.
anyone wanted to get in contact with you and just to speak with you, where could people find you?
So I'm on almost all the platforms. So Twitter, Mr_unique_voice. Same applies to YouTube. Same applies to LinkedIn. Same handle. I won't mention Facebook because I'm hit and miss on Facebook.
Okay.
But yeah, if you just type in that handle, Mr_unique_voice, you will see a lot of things to do with me and be able to get in contact with me. But Twitter's my main place.
Okay, fantastic. You got the Twitter fingers, right? So you're on there, you,
Yeah.
you get busy.
Yeah.
No, fantastic. And are you working on anything, new at the moment that you'd like to share with the world? Anything upcoming?
Nothing at the moment. Doing a few speaking events for different organizations, but details will be out soon on that. Due to a lot of NDAs, I can't say much. In terms of what I'm doing, I'm going to Ghana in the summer. So I'm
Okay,
looking to spread my wings when it comes to disability in the
fantastic.
motherland. So that's my main focus at the moment.
Right, no,
Come
that's
come
great.
come back refreshed with ideas to
That's
support
fantastic. I would
people.
love to have a follow-up chat with you post your trip to Ghana because
Yeah.
I'm working with researchers in Africa,
Mhm,
in West Africa, and it'll just be interesting to hear what your experience is in terms of the landscape there, their
mhm.
attitude, behaviors towards disabilities, biases, discrimination. I want to hear all about it. So I'd love to have a follow-up chat about, about that with you once you
Mhm.
get back from your trip. That would be very interesting.
Sure.
Fantastic. Well, thank you so much for your time, Nana. That was great. I could talk to you all day. And yeah, take care. And we will definitely have a follow-up call, chat about your trip to Ghana later on, hopefully,
Thank
if
you.
you'll have me.
Definitely.
Fantastic. Thanks, Nana.
Thank you.